So we're going to start with our mission. In OHDSI, we've had a mission that's been our kind of guiding light that's been directing a lot of what we've been doing for many years now. Our mission is to improve health by empowering a community to collaboratively generate the evidence that promotes better health decisions and better care. And this community effort that we're trying to do is about having an open science collaborative where we can generate and disseminate evidence. But really, we're here to be a community because we recognize that no one individual, no one team, no one organization can actually solve the big problems that are in healthcare that are big opportunities for using observational data. And we believe that an open science community can be a solution to that we are passionately trying to push forward. And we're really excited that this community has grown substantially over the last 7 or 8 years. We've been working on this. For those who are new and don't know the scope of the OHDSI community, there's now over 2,800 collaborators who have signed on to participate as part of this community. We're representing 74 countries in 21 time zones, which means I get 3 hours to sleep a night. George is still working on getting us our collaborator in Antarctica. Otherwise, we've got the rest of the world covered. But importantly, what it means to be a collaborator is just to share an interest in this mission and to try to find areas where people can, where everybody can contribute to making some meaningful advance to improve health. No matter who you are or where you're coming from, there's an opportunity for you to make a contribution here. What I want to do is walk you through how we are working, and this is a figure we've used repeatedly. It's actually published in a paper that George led in the International Journal of Medical Informatics, International Yearbook of Informatics last year. But our collaboration, our community starts with collaborations, and we have 4 key pillars that we focus on. We collaborate in open community data standards. So many of you on the call are probably here because of some sort of connection to the use of the OMOP Common Data Model. And that's an open community data standard that we support, facilitate, and try to encourage its adoption around the world. We collaborate in open source development. And so some of you on the call may be aware of some of the OHDSI software tools that are freely available for everybody to use. And we have collaborations to develop tools, whether it be back-end R packages or front-end web applications that are tools to enable analysis against the open community data standard. We collaborate in methodologic research. So our focus here is about trying to establish and empirically evaluate scientific best practices. So it's one thing to say that you can perform an analysis for causal inference. It's another thing to know that you're actually going to get a good and correct answer. And a lot of the methodologic research that we try to strive to do is, given that we have data standards and tools, we want to know how well those tools work and how reliable is the evidence that we're going to be able to generate using those practices. And so we collaborate to try to establish that foundation. And then last, but certainly not least, is we collaborate on clinical evidence generation. So the intent is that if there are research questions that are open questions and we want answers to help patients improve their lives, we want to think about how we can actually develop appropriate observational studies, conduct them, and hopefully applying the best practices we learned in methodologic research, codified in our open source tools, using our data standards around the world. That we believe is the secret to generating efficient and reliable evidence. So these collaborations are all opportunities for you all to get engaged as newcomers. OHDSI is also a data network, and how this specifically works is we work as a distributed data network. That means that any organization that's out there in the world who has access to patient-level data has an opportunity to become part of the OHDSI data network. What that means is that if you have access to data, you go through a process locally and securely behind your own firewall to transform your source data into the OMOP Common Data Model. And that process is typically referred to as an extract, transform, and load process. And it also means that you have the opportunity to install and use the open source OHDSI tools securely within your own environment. So any of you on the call who have access to patient level data and you're maybe frustrated by what it takes to actually get evidence out of that data, have the opportunity to go through this process of converting your data to the OMOP Common Data Model and using the OHDSI tools to just answer your own questions in your own data. And this is where a lot of the collaborations actually fit in because of, indeed, the data standards that we have serves as that foundation. But also within our community, you're going to find lots of folks who are eager to help you think about what our best practices for this ETL process and the conventions that you can apply. And similarly, we're not only developing tools, but we're trying to help the adoption of those tools. So you'll see on our OHDSI forums, lots of people posting that they're having questions about how to install software or what does it mean when it's run. And the community's here to collaborate and support you with that installation and use and interpretation process. But the distributed network that we have is not just one data partner, it's anybody with access to data can go through the exact same process, transforming their data using tools to generate evidence. And to date, the OHDSI data network is quite large. At last year's annual inventory, we identified 331 data sources who self-identified as being on this journey, converting their data to the OMOP Common Data Model and trying to use that data to generate evidence. That data network covers over 280 different electronic health record systems and over 28 claims data sets around the world, comprises over 34 countries. And I think probably most importantly to think about the opportunity in front of us, collectively, this represents over 800 million unique patient records. That's over 10% of the world's population. So given that a volunteer community has put together a data standards framework that is now being used by 10% of the world's population, the opportunity in front of us is how do we learn from this data? How do we generate evidence and how do we impact the lives of patients by using this data to generate and disseminate appropriate insights about diseases and treatment utilizations and the effects of medical products and predicting patient outcomes, given that this mechanism exists. And one way that we take advantage of this data network is to conduct OHDSI network studies. The idea of a network study is that anybody in the community, any of you on this call, can design a study whereby you author a protocol that pre-specifies exactly what you want to do. It's accompanied with an analysis specification, which formally represents the idea of what you want to do in code so that it can be executed. Hopefully, those network studies are guided by the scientific best practices we've established and some motivated need from patients. But ultimately, a network study involves that this protocol and this analysis specification are made publicly available for the world as an open invitation to collaborate. And any data partner across the world has the opportunity to download that code, execute it securely within their own IT infrastructure. And what they share back from the code is not patient-level data, but actually results, answers to questions. And those results can be compiled together into aggregate summary statistics that form a repository. And together, we can then collaboratively interpret those summary statistics and disseminate the evidence of the insights that we've gained. And we've been pretty effective in our community in doing this. Within the OHDSI community, we have over 350 publications, including important insights in major clinical journals like JAMA and BMJ and Lancet, as well as important methodologic papers in some of the top-tier journals. And probably more importantly is when we look at impact, we think about how this evidence is actually making a difference to the lives of patients. And we're excited when we see that the evidence that the OHDSI community has generated has been cited by regulatory agencies, has been the reason for policy decisions. We see our evidence being used to support clinical guidelines associated with treatments that we've studied. And really, these provide us kind of a lagging indicator of the value that we think that this open science community brings by allowing researchers from around the world to come together to collaborate on data standards, open source analytics, methods research, and clinical evidence generation, to collaborate together to create a worldwide data network that can then be exploited to generate answers to questions that matter to patients that impact the lives around the world. This is the operating model that we're following within OHDSI. And the way that we want all of you to get engaged is that we have an array of work groups where individual teams are thinking about specific problems across this overall architecture and are thinking about how they can make their contribution. To be very clear, there is no individual, no team, no institution that can do this all by themselves. And everybody that's in our community may have some level of expertise in something, but nobody in our community has expertise across all of these pieces, because to solve the problem of improving health with the world's data requires a vast approach that requires multi-stakeholder perspectives and multidisciplinary thinking. And so any of you on the call that are looking at this and saying, wow, this is really bold and ambitious and I couldn't possibly do this yourself, that's why it's a community. That's why we're trying to bring everybody together where everybody can play their part and contribute to their area where they're interested in. And collectively together, we can accomplish what we think is ambitious but realistic goals about making observational data a trusted resource for providing evidence that can really improve health decisions.